This video will show use of a cold pack during occupational therapy treatment. And a cold pack you want to keep in the freezer. It's filled with a gel, or you can make your own. There'll be a video link on how to make your own with 3/4 water and 1/4 rubbing alcohol. Or a lot of times we tell our clients in-home programs to use a frozen bag of peas so it can mold around the body part. So with the cold pack, you want to have several layers of towel between the cold and the person's skin. And how cold works, it's part of the RICE, rest, ice, compression, and elevation. But cold can make an area numb and reduce the sensation of pain. Also, cold constricts blood vessels, and that helps reduce swelling and inflammation. So the person may also have on a stockinette or a tuba grip or something else that helps with the compression. And that's just sort of another layer. You can think of that as another layer of towel. So a foam elevator could be and depending on how heavy the pack is, you can either put it under or over the extremity, but let's say she has like tendonitis of the finger and wrist extensors. So you'd apply the cold pack. How does that feel?
Okay.
Okay, not too heavy? No. Okay. The reason you would use cold is to help reduce swelling and inflammation. It can also serve as an anesthetic to reduce the pain. You can use it for muscle strains, ligament and tendon strains, muscle soreness if they've worked out too aggressively, and it's also been used in the past with spasticity. Some contraindications, there are a few, they're not a whole lot, but there are a few. Some people actually have a hypersensitivity to cold, and they may break out in hives. It's called cold urticaria. Also cryoglobulinemia, Raynaud's disease, which the person's intolerant to cold, especially on the extremities. If their circulation's impaired, peripheral vascular disease. If there is a deep wound, if there's a superficial wound that you can cover with a dressing or Band-Aid, it's okay, but if the wound's deep, cold is contraindicated. Also, if the person has an infection or psoriasis. So with the cold pack, you want to leave it on no longer than 20 minutes and not lower than 60 degrees Fahrenheit. And also some precautions if the person is a child or someone that's elderly and has impaired cognition, then you want to be careful with that. They may not be able to tell you when it's too cold, and you can get frostbite if you're exposed to cold for too long. Also use caution if the person has high blood pressure. So you saw that we had a 3-layer towels, and these towels are pretty thick. If the towel's thin, you might want up to 6 layers of towel between the cold pack and the person's skin. You can leave this on for 10 to 20 minutes. You want to actually check at the end of 5 minutes. You can ask the client, how does it feel? Is it too cold? But you also want to check, especially the bony prominences, to make sure they're not too white or red. If they're white, you want to stop the cold pack. When the 10 to 20 minutes is up, you want to remove the cold pack and you want to dry the area because it may be wet. And occupations that you could do after the person using a cold pack are gentle active range of motion. In this case, I'm actually going to have her work on the computer a little bit. It's fairly common for people to get tendonitis in their fingers and wrists. Okay, and if you'll take that off for me. Okay, and so a good activity to follow after ice might be something like using the computer, which students do all the time. You can use cold up to 3 or 4 times a day if you stick with a 20-minute timeline. And when you're documenting having used a cold pack, you want to say how long it was on, the site that you applied the cold, any comments from the client, and any changes in their occupational performance after the cold pack, compared to when they didn't use a cold pack and then performed the application.